Hello, everyone, and thank you for taking the time to watch my video today. My name is Jacob Lowry, and I will be presenting on Ohio Rise, which aims to be a betterment of the overall public healthcare system in Ohio. So what is Ohio Rise? As I previously stated, it's a change in the state's Medicaid program to provide more personalized care than previously possible. And it's specifically aimed at the most at-risk population, which is identified to be children aged 0 to 20 who are previously eligible for Medicaid coverage that suffer from the most complex behavioral and medical issues. And oftentimes it looks to those who need an intersection of different public care facilities and entities, and it aims to eliminate the gaps by really individualizing the care and creating a plan both between the family of the child as well as the child and both public, private, all kinds of healthcare entities to just make sure that there's a plan in place to make sure the best outcomes are possible. So, and specifically, kind of reflecting this, Ohio Rise stands for Resiliency Through Integrated Systems and Excellence. So how does Ohio Rise accomplish its mission? Well, according to the webpage, Ohio Rise aims to specifically help, as I stated, those who require the intersection of multiple public services, and it really aims to create a plan of care for these children and their families so that they're not left out in the cold where something might happen. Conditions are better understood now, so they can really create a treatment plan that is fully covered for one, but also fully laid out. So it's easier for all parties to understand, and then those gaps that might result in negative outcomes don't occur. So the program divides Ohio into 20 districts, each of which is covered by what's called a care management entity. And basically that's just a public or private healthcare facility that works with the state and works with the families to kind of provide these services. And they're the ones that are going to help do the planning specifically with the family. As I stated, the system emphasizes collaborative planning between care providers, families, and public care entities to provide the best possible comprehensive care for the patient, regardless of how complex or difficult their issues may be. So why would this program be necessary? Obviously, it's pretty new, so it's important to understand why it's being put in place. And Maureen Cochran, the Ohio Director of Medicaid, referenced the need for these programs because of the gaps that exist in public and private healthcare with previous Medicaid programs. So basically what might happen is a specific portion of this care plan that previous would be in place wouldn't be covered by Medicaid, and therefore families might have to go to the emergency room, families might have to go to expensive behavioral clinics, and overall, obviously, these are just situations that want to be avoided, especially because Medicaid aims to be really helpful and low burden for the families that it covers. So furthermore, old public health care structures in the worst cases could result in complete loss of custody for the at-risk child because of the parents' inability to take care of them, which obviously is no fault of their own. It's just their inability to pay for the expensive services that are needed. Ohio Governor Mike DeWine also would describe the program as giving all Ohioans the better chance to reach their God-given potential. So there is top-level support for this program. So the question now would be, does it really align with what social workers would aim to do with the NASW Code of Ethics? And I would say overall, yes, it does. It most closely aligns with the areas of social justice and the dignity of the person. And it seems particularly designed around these two, as social justice really aims to just overall better society through social work and social programs, with special emphasis on the most at risk of our population. And obviously that's pretty closely aligned with what Ohio Rise aims to do. And moving on with dignity of the person, it really just kind of looks at, view everybody as a person regardless of the circumstances or conditions that might be around them. And obviously, as previously stated, there's been pretty significant conditions and circumstances and complications that are involved with those covered by Ohio Rise. So obviously this applies pretty closely. So as this program is so new, it was introduced in 2022, and it only covers about 20,000 families as of now. There's a limited amount of news and public perception that could be gained, but what does not have a limited amount of kind of verified opinions on is the concept of Medicaid as a whole. So I was able to find two studies that kind of have differing opinions on the outcomes and effects of Medicaid as a whole, one of which was conducted in Missouri in the mid-2000s, looking at a drug rehabilitation program with a control group that did not have Medicaid coverage growing up and an experimental group that did. and it just aimed to see, how well does Medicaid help set up these people for future success. And ultimately, it determined there was no difference between the success rates of the drug rehabilitation program for those that were covered by Medicaid versus those who were not. And on the contrary, there was a much more positive study with respect to Medicaid, and it examined overall the 90s and 80s were a big expansionary period for Medicaid, and it looked at the overall chronic illness rate of those who were without healthcare coverage from the 90s and 80s and those that were covered by Medicaid, and it concluded that those that were covered had a much higher or much lower chronic illness rate moving forward in their long-term lives. So it really did sing the benefits of Medicaid, and it really aims to expand these programs and supports that kind of legislation. So finally, just some discussion questions about the program. So what is your overall perception of public health care in your home, where you come from? I know for me, I'm from Ohio, and I didn't have much perception of it before this research. So I'm just curious how you would break down your own perception of public healthcare systems from where you're from. And then can you think of any other areas of social policy that could be benefited by a more individualized approach like that's utilized in Ohio Rise? And then why would you say this would be a benefit? And then how would you go about making this change to this social legislation? All right, that's about all I have. Thank you guys all so much for listening, and I hope you found my presentation informative.